Department of the Respiratory Medicine, PGI Rohtak, and also the state chair for the Haryana. Now, this is actually a very practical problem which we are discussing, and we are making some recommendations, and for which I thank all the participants in my groups for their very valuable contributions, suggestions, and also to the WHO consultants, facilitators, and especially to Professor Behra and Professor Sharma, who have especially presented this group and make their significant contribution. Now, how to intensify the case finding, because target is coming of the universal access of the 90% case finding. So, what strategies will be there? Because as a medical college, we have the not only chest department of Department of Respiratory Medicine, also other department referral cases, and the interdepartmental referral and the strategies to contribute the cases is very, very important. How to back or how to involve these departments in the DOTS program or country control program. Now, interventions in the medical college and interventions in the community. For the patient, the participants to whom you are diagnosing, so community participation is very, very important. Now, intervention in the medical college, that we have to intensify our case finding during the registration itself and channelizing them to the concerned department. At least the person who is receiving the patient registration counter, he must be, you can say, aware of the fact and whom and where to refer these patients for the, you can say, earliest diagnosis. Active advocacy of the DOTS in all possible forums by the medical colleges and about the negative impact of the private anti-TB drugs. Now, actually, at this point we included because we see in the other departments cases are diagnosed and they are first written about the, you can say, the drugs from the private sources. Sometimes patients is after 2 months that I am not able to afford it, so then they are referred to our department, DOT center. Very difficult to just register in between sometimes to help the patient fully. So this is actually the idea. Then the screening of the TB patients. Now, active screening. There are certain groups, target groups, where they need more intensified screening and the more care, like patient having the immunocompromised status and the persons who are chronic smoking, you know the link of the smoking and the tuberculosis. And the certain occupational groups, like silicosis groups, they have the more prone, coal workers groups. Then the context to the, especially the close household contacts in the family and the